I'm from a small town called Seven Springs, North Carolina, which is about an hour drive southwest of Greenville. I grew up working on my grandparents' farm, so I've worked in chicken houses, hog houses, I've cropped tobacco, I've driven tractors for harvest. That is back-breaking and grueling work. There is no more powerful motivator in the universe, in my humble opinion, than standing in the middle of a tobacco field in late summer with 99% humidity, no shade. It's 100 degrees outside. Your hands are caked with tobacco gum. It motivated me to do other things. So when I graduated from high school, I came up here to ECU. I did 2 undergraduate degrees here, did a master's here, and then I worked for the State Food and Drug Administration for a few years. I worked in the community college system for a few years. I went to Brody. I stayed on for family medicine residency here, became faculty, and then because of all of my ties into the rural areas of eastern North Carolina, I suppose that's why my higher-ups decided to task me with heading up this rural program. Growing up, a lot of people who are not from the area won't remember things like Hurricane Fran or Hurricane Floyd, but I remember them very vividly. So my town of Seven Springs has flooded several times with hurricanes in the past 20 years. I remember the struggles of people that were sick, people that were elderly, trying to get to places they needed to get without electricity when we were literally an isolated community, which just kind of provided some buy-in to me psychologically that you need to have doctors in these rural communities. You may be truly isolated where you can't get people out, and you need to have boots on the ground there where they can take care of the patients in their communities in real time. And I think that experience, even though it was in the back of my psyche, played forward in my work ethic to try to get this rural program up and running.